Hi guys, my name is Coderness and I am a certified coding specialist through AHIMA. I am here to help you learn, so let's get started.
Today we will be discussing non-medical surgical sections with the root operations definitions and an example. This is ICD-10-PCS. These sections we will be covering are obstetrics, placement, administration, measurement and monitoring, extracorporeal or systemic assistance, and performance, extracorporeal or systemic therapies, osteopathic, other procedures, chiropractic, imaging, nuclear medicine, radiation therapy, physical rehabilitation and diagnostic audiology, mental health, substance abuse, and new technology. In the obstetric sections, there are two root operations, and they are abortion and delivery. Abortion is artificially terminating a pregnancy. An example is an abortifacient is used to terminate a pregnancy. Delivery is assisting with the passage of the products of conception from the genital canal. An example is spontaneous vaginal delivery. The next section is placement. Change, compression, dressing, and other root operations are involved in this section. Change is taking out or off a device from a body part and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or mucous membrane. An example of this is change of a device in the jejunum. Compression is putting pressure on a body region. Example is compression of the lower right arm. Dressing is putting material on a body region for protection. Example is the abdominal wall is wrapped for protection. Immobilization is limiting or preventing motion of a body region. An example is a broken arm is casted to prevent the movement of that arm. Packing is putting material in a body region or orifice. Example is packing the nasal cavity to control epistaxis. Removal is taking out or off device from a body part. An example is a myringotomy tube is removed from the ear. Traction is exerting or pulling force on a body region in a distal direction. Example is pulling on a limb in a distal direction. Administration is a section. Introduction is putting in or on a therapeutic, diagnostic, nutritional, physiological, or prophylactic substance except blood or blood products. Example is patient is given an analgesic through the central artery. Irrigation is putting in or on a cleaning substance. Example is flushing a surgical wound. Transfusion is putting in blood or blood products. Example is a patient receives blood labs after labs show the red blood cell levels are low. Measurement and monitoring is another section of ICD-10-PCS. Measurement is determining the level of a physiological or physical function at a point in time. Example is the coronary artery flow levels are taken. Monitoring is determining the level of a physiological or physical function repetitively. An example is blood glucose levels are evaluated over a 24-hour period. Another section in ICD-10-PCS is extracorporeal assistance and performance. Assistance is taking over a portion of a physiological function by extracorporeal means. An example is intermittent positive pressure breathing for 37 hours. Performance is completely taking over a physiological function by extracorporeal means. An example is mechanical ventilation for 20 consecutive hours. Restoration is returning or attempting to return a physiological function to its original state by extracorporeal means. An example is cardioversion. Atmospheric control is extracorporeal control of atmospheric pressure and composition. An example is atmospheric control single treatment. Decomposition is extracorporeal elimination of undissolved gas from body fluids. Example is hyperbaric chamber decompression, single treatment. Electromagnetic therapy is extracorporeal treatment by electromagnetic rays. Example is central nervous electromagnetic therapy, single treatment. Hypothermia is extracorporeal raising of body temperature. Examples is hyperthermia, single treatment. Hypothermia is extracorporeal lowering of body temperature. Example is whole body temperature hypothermia. The previous slide and this slide are both extracorporeal therapies. Perfusion is extracorporeal treatment by diffusion of therapeutic fluid. An example is ECMO. Pheresis is extracorporeal separation of blood products. Example is leukapheresis. Phototherapy is extracorporeal treatment by light rays. Example is phototherapy of circulatory system series treatment. Shockwave therapy is extracorporeal treatment by shockwaves. Example is musculoskeletal shockwave therapy, single treatment. Ultrasound therapy is extracorporeal treatment by ultrasound. Example is ultrasound therapy of the heart, single treatment. Ultraviolet light therapy is extracorporeal treatment by ultraviolet light. Example is ultraviolet light phototherapy, series treatment. This section discusses osteopathic. Treatment is manual treatment to eliminate or alleviate somatic dysfunction and related disorders. Example is fascial release of abdomen, osteopathic treatment. This section is other procedures. Other procedures are methodologies which attempt to remediate or cure a disorder or disease. An example is acupuncture. This section is chiropractic. Manipulation is manual procedure that involves a directed thrust to move a joint past the physiological range of motion without exceeding the anatomical limit. Example is chiropractic treatment of cervical spine, short lever specific contact. This is the new technologies section. Assistance is taking over a portion of a physiological function by extracorporeal means. Example is intermittent positive pressure breathing for 37 hours. Bypass is altering the route of passage of the contents of a tubular body part. Example is gastric bypass. Destruction is physical eradication of all or a portion of a body part by the direct use of energy, force, or a destructive agent. Example is laser interstitial thermal therapy. Dilation is expanding an orifice or the lumen of a body part that is tubular. PTCA, percutaneous transluminal angioplasty, is an example. Extirpation is taking or cutting out solid matter from a body part. An example is cerclage suture removal. Continuing on with new technology. Fusion is joining together portions of an articular body part, rendering the articular body part immobile. Example is fusion of thoracic vertebrae. Insertion is putting in a non-biological appliance that monitors, assists, performs, or prevents a physiological function but does not physically take the place of a body part. An example is placement of a vascular access device. Inspection is visually and/or manually exploring a body part. An example is a bronchoscopy. Introduction is putting in or on a therapeutic, diagnostic, nutritional, physiological, or prophylactic substance except blood or blood product. An example is a nerve block injection. Irrigation is putting in or on a cleaning substance. Example is flushing a surgical wound. Continuing on with new technology. Measurement is determining the level of a physiological or physical function at a point in time. An example is the coronary artery flow levels are taken. Monitoring is determining the level of a physiological or physical function repetitively. Example is blood glucose levels are evaluated over a 24-hour period. Other procedures are methodologies which attempt to remediate or cure a disorder or disease. An example is acupuncture. Replacement is putting in or on biological or synthetic material that physically takes the place and/or function of all or a portion of a body part. An example of this is a bone graft. Continuing on with new technology. Repossession is moving to its normal location or other suitable location, all or a portion of a body part. An example is reduction of a displaced fracture. Restriction is partially closing an orifice or the lumen of a tubular body part. An example is fundoplication. Supplement is putting in or on biological or synthetic material that physically reinforces and/or augments the function of a portion of a body part. An example is a herniorrhaphy. Transfusion is putting in blood or blood products. An example is a patient receives blood after labs show the RBC levels are too low. Thank you so much for taking time to listen to my video. I hope you found this video beneficial. See you guys next time. If you have any questions, leave them in the comments below. As always, thank you and have a great day. Coderness out.